My question is, are you familiar with a single instance in the Commonwealth of Virginia where you had an egregious, horrific example that you previously described?
Yeah, there was a woman who died in Northern Virginia. I think that's what was being referenced there by misuse of anesthesia. There's also been instances where we've had doctors, and you can go through the files. These are public. Once the doctor gets reprimanded, that's a public file. There have also been instances where, because an ultrasound was not used, the fetus was basically the guess of the age of the fetus was wrong, causing the abortion doctor to go in and do a procedure incorrectly because he thought it was an earlier term fetus than it was.
That information is helpful. Thank you. Mr. Chairman, just so that I'm clear, you are in favor of regulating these abortion clinics, correct? My question then is, are you also in favor of regulating the doctor's offices that do the same type of invasive surgery?
I think it's a very important issue that we are looking at carefully to see what if data is out there, to see which of these procedures, which of these things need to have further regulation.
Sorry, Mr. Chairman, this is for Ms. Cobb. Ms. Cobb, I appreciated in one of your responses earlier your acknowledgement that this is a highly political issue all around. And so I'm just curious to know, I've got some data from the American Medical Association that shows that the complication rate for abortion is 0.3% compared to 1.7% for tonsillectomies, 1 to 5% for breast augmentation, 0.4% to 3.5% for LASIK surgery. And in LASIK, 10% of those patients also need additional treatment. So abortion is safer than any of these fairly common procedures that happen in doctors' offices that are subject to the same rules and regulations that abortion providers are currently subject to. Then why is there no group before us every year trying to ban or I should say regulate tonsillectomies or breast augmentations or LASIK surgery?
I'll be really honest with you. I think most Virginians want to know when they walk into any of these places that they are regulated and safe, whether you're getting a tonsillectomy or you're getting an abortion. And I will tell you that women in particular, if they walk into an abortion clinic and know that they have the chance of walking out and never being able to have a child again because their uterus has been perforated, they really, really want to know that it's been regulated and that when they've made this choice, that it's now legal and it is actually safe. That's what they want to know.
I guess my question is, given your concern about safety overall that you just expressed, can we expect the Family Foundation to be putting forward legislation next year on tonsillectomies and breast augmentation and LASIK surgery?
That's generally not our scope, but I will tell you that if doctors were being arrested in those fields for murders and if there were complaints at this level, you'd see outrage from groups that are involved with that particular issue. They'd be lining up here asking for regulations.
Thank you, Mr. Chairman.
The young lady keep bringing up New Jersey and other states. I'm concerned about, do we have a problem in Virginia?
I have a question for Dr. Remley, and I'd like to just quote a statistic from this particular case, and that is that none of the employees had any medical training. Is this a situation that could happen in Virginia that we don't have jurisdiction over, that none of the assistants can have medical training and still be allowed to work in these clinics?
I would turn again to, I don't know if I have a colleague from the Department of Health Professions here, but we don't regulate these clinics in Virginia, so I don't have any knowledge or oversight of what happens there. The employee.
Okay, in today's paper, there's an article, and it does state that it was a high school student that was administering the anesthesia in lethal doses, and the woman actually died from a Demerol overdose.
This is not Pennsylvania, and this is not New Jersey. And those cases, I guarantee you, they're egregious, and they turn police. And if those things were happening here in Virginia, I'd be the first one, and I know many of the other women's advocates and healthcare advocates would be doing the same thing. The thing that stands out about those particular cases is that those states do not regulate second trimester abortion like we do here in Virginia. Those particular procedures are done in hospital-like settings or ambulatory surgical settings, and the ones that I know of are actually done in hospitals. And we know here in Virginia, the clinics that we're talking about are performing first trimester abortions, which are the safest that we know of procedure when it comes to abortion, and that's under 14 weeks. So I want you to keep that in mind when these particular things are coming up. And we actually, my organization, put out statements about these particular instances in these other states, because apparently they don't have the same kinds of regulations that we have here. We don't hear of these situations going on, and like I said, I would be the first one to stand up and make sure that we were regulating those particular instances because I am here to protect women's health. Furthermore, here's what you really need to know about the medical professionals who perform abortion here in Virginia. They provide top-notch care. Less than half of 1% of abortions result in complications. More than that, to say abortion clinics and providers in Virginia are not regulated is false. They meet the same regulations imposed on all of Virginia's doctor's offices, and those regulations are working here in the Commonwealth. Physicians who perform first trimester abortions are, at a minimum, licensed and regulated by the Board of Medicine, the Board of Health Professions. They're also licensed, their staff are licensed by the Board of Pharmacy and the Board of Nursing. They're also subjected to federal regulations of HIPAA, OSHA, and CLIA. Abortion is, in fact, one of the safest medical procedures in the United States, and you can check that out. Don't take my word for it. The American Medical Association, the American College, and the American College of Obstetricians and Gynecologists. Abortion clinics are not in need of special and additional regulations. Furthermore, there are several outpatient procedures that we've already noted here today that have higher complication rates than abortion. Colonoscopies, endoscopies, LASIK eye surgery, breast augmentation, rhinoplasty, facelifts and other cosmetic surgery, removal of cysts and lipomas, minor breast biopsies, and the removal of ports and catheters. So I ask you, are you willing to impose these same regulations on these doctors' offices that perform these particular types of procedures? Today I have with me Shelley Abrams. She is the director of the Capital Women's Health Center here in Richmond. Her facility is a member of the National Abortion Federation, which is a professional association for abortion providers, and NAP provides oversight and accreditation for its members. And I passed out their accreditation standards, so if you want to take a look at those. And NAP conducts on-site visits and assessments, and I'd like Shelley to actually tell you a little bit more about that. Thank you so much for your time.
Yes, ma'am. Come forward. You got 2 minutes.
Hi, my name is Shelley Abrams. I'm the site manager of Capital Women's Health Clinic, which is a local clinic here in Richmond, and I'm the executive director of 3 other facilities. For the past 15 years, I've worked in and supervised multiple abortion providers in multiple states. Firstly, I'd like to say in Virginia, a clinic such as ours already abides by the following legal requirements. We provide all patients with state-mandated information regarding the abortion procedure, its risks, possible complications, all this done at least 24 hours before the patient's appointment. We also provide information on how she can obtain child support should the patient wish to continue her pregnancy, and information on resources for the duration of her pregnancy. We require every minor child to bring a parent to her appointment, and we notarize her parent's written consent. And we're only allowed to perform abortions in the first trimester. As Tarina mentioned earlier, our facility is a member of the National Abortion Federation. Membership in this organization is voluntary and subject to approval based on inspection, investigation, and our investigation of our reputation and our physician's reputation, and our agreement to in compliance with the organization's guidelines. Our initial inspection was conducted by a licensed nurse practitioner who spent an entire day at our clinic. During her visit, she followed patients through their lab tests, ultrasound, and counseling. She interviewed the staff and doctors, she watched the physicians perform a procedure, and she reviewed protocol and charts. Furthermore, our physicians...
Maybe if you could wrap up, or a little overtime, I want you to be able to wrap up, please.
Our physicians and nurses are licensed by the Board of Medical Professionals, and their licensure must be renewed every 2 years. Our doctors are licensed by the Drug Enforcement Agency. Our lab is licensed and inspected by the Clinical Laboratory Inspection Agency. And I have to tell you, every day of my life, and even some of my nights, are spent thinking about regulations and patient safety. This is probably true for most every doctor, nurse, or manager who works in a doctor's office.
Okay, ma'am, I'm going to have to cut you off for fairness. I've been announced 5 minutes. Thank you for already gone a little over. Delegate Hope, question?
I would say this. First of all, I don't think we've made any allegations here today. And secondly, unless you've been in all 21 of the clinics in Virginia, We have no way of knowing what's going on in there. This bill is proactive. We don't want to be sitting back and react to a situation that was noted earlier in this meeting. This bill is about the role of government to protect its citizens. It's about patient safety and health care for women.
Or the pending question is to report without amendment. House Bill 1428. Members record your vote on the electronic voting board. Have all members voted who care to vote? Roll is closed. Bill is reported 15-6.